Fibromyalgia is in the news this week when the New York Times wrote a couple of articles about issues of how patients are suffering from the problem and what kind of research is being done. What's so remarkable is they're quoting from a variety of sources involving the World Health Organization, the CDC, American College of Rheumatology, Arthritis Foundation, National Institute of Arthritis, Musculoskeletal and Skin Diseases, the Mayo Clinic. All of these places are cited, and yet nothing in these leads from the AMA News, where this information is coming from and being quoted, nothing mentions anything about sleep, not a single thing. Now, it is possible if we went deep into each of these articles, there would be a little tidbit, but in my experience, what always gets mentioned about sleep and fibromyalgia is the word sleep disturbance. That's it. That's the story. And yet, it's been widely known for years now that many fibromyalgia patients, if not most, if not all, suffer from actually diagnosable sleep disorders. The most common one being sleep-disordered breathing, and the second most common being periodic limb movement disorder and restless legs. So, yes, fibromyalgia is a real condition, which is what the New York Times is trying to tell us is new information in some way. Yes, fibromyalgia needs a variety of supports and treatments to help those patients, but from our perspective, they continue to miss this point that sleep and sleep disorders are critical components to the process. And I would encourage all of my listeners and viewers to be looking at the Fibromyalgia News Network, which is run by a friend of mine, Kristen Thorson, and they do an excellent job of covering a whole range of symptoms and treatments and give a great deal of information about the treatment of sleep disorders in fibromyalgia patients.